Welcome to today's emergency department, home to nearly half of all healthcare encounters. ED clinicians attend to dozens of emergencies per shift, not to mention supervising staff, documenting, and staying safe while working the front lines of public health emergencies like COVID-19. But for patients with little visibility into all that, it just feels like a whole lot of waiting, worrying, and frustration. It's no surprise that satisfaction scores in the ED are often the lowest in the hospital. These extreme conditions are also why emergency medicine has the single highest rate of physician burnout. Enter EdLoop. EdLoop was created by an ED physician to address the issues she saw affecting her patients and colleagues every day. The platform connects patients with their ED care team so they have insight into what's happening around them, the same way we get updates on prescriptions, transportation, and even food delivery. Patients sign up, see the doctor who will be caring for them, and get SMS notifications about what's happening with their care. No need to download an app. By providing information and explaining the process, patients feel informed, connected, and cared about, even when it isn't face-to-face. This digital communication boosts clinical outcomes, including better treatment adherence and reduced readmission rates, all while preventing disease transmission among clinicians and patients. How do patients get these updates? Our platform makes it simple. ED clinicians and support staff can easily send one-way messages with a couple clicks. The tool can be customized to support an ED's specific population and workflow, and provide education and tips about what's going on with their care, or navigation to outpatient follow-up. It's HIPAA secure and works in multiple languages, and it's flexible enough to accommodate healthcare's inevitable twists and turns. EdLoop's impact has been tested and proven. Doctors embrace it because it allows them to maintain strong doctor-patient relationships, even while social distancing. This saves them time and also decreases their exposure to infection, protecting them, their patients, and their staff, plus using less PPE. You can trust the first-hand experience of an ED doctor to create a tool that works in a real-world environment, and these updates are hugely meaningful to patients. A full 95% say getting updates improved their experience in the ED and made them feel better informed. Another thing, poor communication in the ED is a costly problem. It results in about $11 billion in lost revenue every year due to things like high readmission rates, physician burnout, low satisfaction scores, and malpractice lawsuits. Through managing patient expectations, EdLoop helps with all these metrics, saving you money and helping you attract, protect, and retain talented clinicians. EdLoop is easy to implement. With our Quick Start plan, no integration is needed, and you can start seeing results and relief within just 90 days. EdLoop, bringing connectedness, efficiency, and safety to the ED through digital patient engagement. Give it a try and see the difference it makes.